I heard a kind of cool thing from Eric Topol, who is one of the best cardiologists out there. He's a bit older now. He's the head of the Scripps research department called Translational Institute. And he was talking about the incredible importance of the way we're going to start treating cancer and the excitement around treating cancer, really using vaccines. So even though there's a lot of anti-vax, and I know RFK gets people consider him anti-vax, and maybe he is, I don't know him personally. But I will tell you that the data on vaccines for cancer and the idea that we are going to basically be able to find out the specifics of a vaccine, solid or blood. It can be a solid tumor or it could be a blood tumor. That learning what they are and vaccinating against them, because they have signals on them that we can get very specific antibodies towards.
And then that's your immune system going after them.
That's your immune system. So that's why I wanted to talk about it. But it did actually, he just produced something recently that was amazing on the various pipelines of vaccines that are out there for cancers. Why does a pancreatic cancer, no one wants that, but why does one person get it out of the blue? And we know there's some genetic reasons, we know there's some environmental reasons, but we also know that what it looks like really early can be potentially vaccinated against.
And that would be absolutely amazing.
Yeah. And using that same technology to treat it once it was there as well, because it's the same idea. Obviously, you want to have the vaccine so it never happens, but you also want to be able to treat it with your immune system, charged up immune system. So basically, you're charging up the immune system that has always been keeping it at bay, and you can charge it up by learning more about it. So that's a really new, cool thing. Like, I think we want to keep our eye on that has to do with this very delicate balance between too much immune system, too little immune system, like we saw with Kyle Busch, I think, and just the right, like the Goldilocks of immunity, starting at the thymus gland, which we can really, there are great tests to check for that. So these these new cancer-related immunologic treatments are amazing. It's funny, I have a colleague that I work with, I'll mention his name because he did something really terrific. His name is Eliav Bar, and he was one of the first guys. He works now for Merck. I think he's the chief medical officer for Merck as a doctor. His father's a cardiologist. I know the family. But the bottom line is, I know he was at one point in line for a Nobel Prize. I don't know if he still is or not, how that works. But he was the guy that put in motion and made happen through Merck a treatment for a cancer called cervical cancer that was not what we thought it would be. It wasn't a resection. It wasn't chemotherapy. It was actually the human papilloma virus vaccine.
That's okay.
Human papilloma virus correlated to being an increased risk for cancer in the cervix. So he made really Gardasil. And Gardasil is for all young girls so that they don't get the sexually transmitted virus that could then predispose so many of them to cervical cancer because of the immune system situation. So it led the way for so much of this other research. It's not exactly the same, but that was the first time it was used in our medical system.
That's,
So you have experience with, I mean, I know you were around when this started becoming normalized.
When it was recommended, became one of the recommended vaccines. And I think at the very beginning, we started just like you're supposed to give it to them a year or two before they became sexually active, which was kind of hard to determine when they're going to be sexually active. So then, the age went from like 12 to 11. And I think right now, the guidelines are at 9.
Yeah, because you can turn those on, and then we've greatly improved the rates of cervical cancer. And that's going to happen now with different vaccines. in a different mechanism, but it kind of started at least on a population basis with Dr. Barr's perspective and Merck's perspective there. And now we're seeing the dawn of a new age because AI can help it. AI is advancing it in such a way that I think we will have in our lifetime both vaccines to prevent and immunologic treatments for most of the cancers because the body is turning off cancers and it doesn't work periodically. So we're going to use the same body mechanism, specifically the immune system, to fix them. Yeah. And so that's really cool. And I also appreciate Eric Topol's perspective on it, which I recently watched. If anyone wants to watch it, I think it's a little scientific oriented, but
that's what I like about it.
No. I think it's more geared towards doctors, but there are a lot of people that love to listen to that, and so he's Eric Topol.